Everything's happening. It's we're pretty darn busy trying to incorporate all the things we've incorporated. We brought on a plastic surgeon named Jennifer Lee, no relation to me, but she's doing aesthetics and the Botox and the fillers and those kinds of things, and liposuction and lasering if you really need that type of service. And then we brought in Dr. Snydak, who is a retired anesthesiologist, and he's been injecting joints for people having painful joints. And when stem cells started up about 5-6 years ago, he started doing that with miraculous results. So he's on board. So we can take care of problematic joints, we can take care of facial things or aesthetics things, and we're still doing the core business, which is age management, which really kind of ties it all together. Age management looks at things like inflammation and too much sugar and methylation and oxidation. These concepts apply to joints. They also apply to skin. So we're wrapping it all together, if you will, providing the entire spectrum from working on your insides, age management, hormones, supplements, and then to working on the outsides, which is the aesthetic part of it, and then joints for mobility. So I think it's a complete package, and that's what we've been striving to do. We also brought in a new nurse practitioner who has a great background, a great experience from labor and delivery to nurse practitioner to hormone work to functional medicine. So we're covering all the bases. Well, I like to say we're either regenerating or we're degenerating. So you can't, it's hard to write in between. So regenerating is simply making a disease part whole. For example, somebody has a painful knee, you can take pain medications, you can take you can take opioids, you can take the non-steroidal type of medications like Aleve and Advil and Motrin. You can take, you can inject the knee with steroids or with hyaluronic acid, but none of these things fix the problem. And in fact, it's kind of like you're masking the underlying problem, because even though you make the pain go away with these medications or injections or whatever, the disease process is still continuing onward, so the knee is degenerating. The only way to stop the degeneration is to get the PRP, platelet-rich plasma, and or stem cells into that knee, and it's going to heal the knee and stop that degeneration process. To stop the degeneration process and continue it forward, you've got to pay attention to the age management principles, because whatever got your knee into that shape in the first place is going to be assaulting that knee even after stem cells, unless you fix the assault. So this is where age management and regenerative kind of combine together, weave together to make a better outcome, a stronger, longer, good outcome. Well, it's the same thing. Having done 6,000 deliveries, I've seen a lot of lacerations and things that occur in the vagina, which results in bladder leakage, painful intercourse. Menopause heads you off into really thin walls, so that is tender, painful, itchy, burny, those kinds of things. So what we do is we restore what should have been the normal anatomy, and we can help to stop urinary incontinence. we can return the vasomucosa to normal so that they're not dry and itchy, and intercourse can be, the sexual response can be enhanced greatly. Yes, injections of platelet-rich plasma, PRP, and/or stem cells, it depends upon the severity of the problem, whether you use just PRP or you add the stem cells in with it. But yeah, we can do that for men and help to correct erectile dysfunction problems. You would ask me about hair thinning? That's not fair. Actually, yeah, you can restore hair. It works better in people who have thin hair rather than no hair. But even with no hair, you can inject stem cells, and there's a possibility you might have some success. But it works really, really well for women who have thinning hair. And then it's easier because it's only PRP. You can inject that in the scalp and then bring the fullness of that head of hair back to life. Well, the expectation is that we'll get these new services, aesthetics and the regenerative piece, PRP and stem cells, get those things going and robust, even to the extent that we might need more docs and/or practitioners here to handle the volume of the load. But we are very, very unique in that you've got a plastic surgeon, a joint specialist, and an OBGYN all working together. We have different views of the same problem, but it kind of boils down to us working together and drawing on each other's expertise to provide better outcomes. Probably the breadth and the depth of the services we provide. Age management is the core, because I like to say 85% of the things that kill us are avoidable. And so with age management, we find out what's your weak link in your chain, and then we fix it up so that it's no longer a weak link. In so doing, the idea is to create better health and to feel better and to be able to play with the grandkids and those types of things. So it's really the broad brush of what can make me better, what can help me to avoid the heart attack, to avoid the cancer, to avoid the disease. What kinds of things can we do? And in the process, people simply feel better, have more energy, better cognition. So we think we're providing a pretty complete service.